Hi everyone, let's talk about the American Cancer Society guideline about not doing monthly self-breast exams. So although this has been circulating in the news and social media recently, it's actually not a new guideline. It has been in place for about 15 years, and it's based on studies that are 20 years old, if not older at this point, showing that doing monthly self-breast exams did not increase survival from breast cancer. So people who were doing their monthly exam, maybe finding something, being diagnosed with breast cancer, they weren't living longer as a result of that. And so that then kind of drove this recommendation of, you know what, we're not going to tell people to do monthly self-exams. Now, there's a couple of issues with that. The first is that these studies are 20 years old. We have much better diagnostic techniques now. We have much better treatments now that we didn't have then. So it's hard to say is that if you repeated those studies now, whether you would have the same results. And I think that if we recommend something that's 20 plus years old, it's probably not accurate anymore. And we should be revisiting this. The next thing is that incidence of breast cancer is rising in younger women. Many women are diagnosed before the age of 40, or they haven't gone for their routine mammograms. Many of these women are not considered high risk based on genetics or family history, or even some of the risk assessment calculators that we use, like the Tyrer-Cuzick. So they're not being identified as higher risk, and they're not going for earlier or more intense surveillance. And so with this rising incidence, again, it's hard to say that data from 20 years ago is still going to hold true today. And now even the clinical breast exam is not being recommended, meaning when you go for your annual with your GYN or your primary care, the American Cancer Society guidelines say that clinical breast exams don't need to be done. Now, it's possible that no one is doing breast exams on you. So that's kind of where things stand. Now, the guidelines do recommend knowing what your breasts look and feel like. So if there is something abnormal, you can, seek medical attention. And we were having some conversations around this, and one of the comments that came up, which I think is so important, is that if there isn't a push to advocate on what your normal is and how to feel for that normal, then how do you know what your abnormal is? So that I think is a really, really important point. What I recommend is doing regular breast exams, but doing it actually throughout the month. I think if you only do it on a certain period, a certain day of every month, you may miss some of the hormonal changes and fluctuations that happen. So I think knowing how to do a breast exam is important, but also doing it and feeling your breasts throughout the month in different positions, in different ways. So let me know your thoughts. I think this is a really important conversation. I think that I want to hear from you about how you found your breast cancer, if you did, and what your experience was like. And also, are you having breast exams? I still have been having them when I go for my annual exam, and I want that to continue. So I'd love to hear from you.